Hello, good afternoon. My name is Wayne Dorman. I'm a doctorate of nursing practice student at George Fox University, and this is my video analysis of an informatics article. The title article that I would like to highlight today is Artificial Intelligence Applications in Healthcare and Consideration for Nursing Education. This was published by the Nurse Education and Practice Journal. Authors are Lee Montejo, Ashley Fenton, and Jaron Davis. Very interesting article here. It essentially biggest highlights were about what the applications of AI are currently, and it definitely floated the need for nursing education on this topic, highlighted core competencies that need to be done. As AI is exploding, it's basically going to go from a revenue of around $6 billion to about $67 billion. So it's going to grow by about 10 times by 2027. So the growth in AI, it's not going anywhere. It is going to be used as a tool, and remarkably, some of the things that we're using it for, and most of which I hadn't even heard of, and most of which a lot of colleagues that I was speaking to as we were integrating this when I worked in the ICU, they were talking about using it as a clinical decision support system. Things like looking at trends in your patient data, looking at what medications they're on, having it sort of there within Epic to just populate, deterioration indexes, things like that. Basically, AI is going to be an assistive thing in terms of looking at your patient's chart and trying to predict care outcomes and clinical decisions. So that's one thing that I definitely heard of. Most nurses and most of my colleagues, however, had no idea. It's like, what, using AI in healthcare? How can we even do this? The talk was like, using it for remote monitoring and bed alarms and things like that. But I think most people have no idea that it's going to be used or it's being used, and have no idea even about it. There's a huge, vast amount of the workforce that is not really prepared to utilize this technology. So some of the other things, before I get too out of myself, before basically the call for education is going to be huge in terms of preceptors and in terms of education within nursing programs. I'll talk a little bit more about that later, but I do want to talk about some of the applications that they mentioned using AI for. So AI, as we know, it's really good at looking at big data. It's really good at processing natural language and being able to take all that data and really interpret it, read it, and utilize it all at once, something that a human just cannot do. So really good at stuff like that. Some of the other things that we're using it for, and this was amazing, drug discovery. It's basically utilizing AI to come up with new drug compounds and new formulations of drugs. So this is going to be hugely used within research. I'm so hopeful of this because I feel like on that front, we're going to be able to find medications that are safer, better, and be able to treat diseases that we never could have dreamed of. So that's an amazing thing that the article highlighted. Using it for robotic-assisted surgery, when I first read this, I thought, wait, is AI going to replace the surgeon? But it's absolutely not. What it's going to do is it's going to be, at first anyway, it's going to be used as a tool for tissue recognition. It's going to be used as a tool to help with degrees of angle in terms of recognizing, how close you are to, say, an artery or something like that. It's going to be able to utilize the technology and be able to accurately depict that, where spatially maybe a surgeon at the robotics modules, it's going to be a difficult thing for them to interpret on the fly. So really an assistive tool there. Radiologists, I heard Dr. Whitley had mentioned that it's going to probably replace radiologists one day. So evidently it can reproduce results faster and more accurately than a radiologist can. So that's a legit something that AI will continue to do. So basically the article lays out that AI is going to be used more. It's going to be used for amazing things. It's going to be an assistive device. So we have to, instead of being reactive, we have to be proactive. There's not a whole lot of research on nursing education when it comes to utilizing AI. Not a lot of research. At least the article is dated from 2024. Okay, and the lifespan of AI, that's 100 years ago. So could be something else to research and look and see if there has been a lot of fronts or if there is current research being done. And I imagine there is. But as of the dating of this article, the call was more research needs to be done. More things need to be implemented into education and teaching not only staff nurses and nursing students how to utilize this more, but mainly integrating AI into our core curriculum. AACN Domain 8, it states that we need to utilize informatics is no longer a soft skill, but it's a core competency. To read, I can use my notes here just to read this, but AACN Domain 8 says that we must use technology and we must use evidence-based frameworks to utilizing technology in order to help us deliver nursing care. So the call there is not only having AI, we're going to be using it, but also having the training to be able to use AI as a core competency. And that is a huge shift, something that I haven't really thought about, but that's the call. We need more nursing education on AI. We need more tools for teaching our current nurses about AI. And so my big takeaway is AI and humans are going to basically have a synergistic relationship. AI is going to handle a lot of tasks, but it's not going to replace nurses at the bedside. It's not going to be able to understand the loved one sitting in the other room as the patient is on the table. It's not going to be able to do some of the things that is inherently human. AI is not going to be able to show beneficence because there are problems with AI. Things like algorithmic bias, things like misinformation. I actually came across a term in my studies called AI hallucinations. It's basically where it gives nonsense and it gives you data that's not even related to the topic. So AI is not perfect. Excuse me. And it needs to be used as a tool, and people need to be appropriately trained on it. Excuse me. My gut feeling is that as we're doing this in real time and as we're studying and as we are evolving, we are going to graduate in the year 2028. Everything is going to move at light speed. It is going to change so much right before our very eyes as we're conducting our education. So we need to continuously be aware of it. We need to continuously talk about it. We need to continuously build educational programs around it. I thank you for your time. I can't wait to hear your guys' opinion on the article. I hope you get a chance to read it and look at some of the cool things that AI is doing and some of the challenges ahead. Thank you so much.